Rachel O'Brien joins me now, who's Deputy Public Policy Editor at OpenTheBooks.com and an investigative journalist. Rachel, welcome back to the program.
Thanks so much for having me back.
So how much of a difference could it make if the DOGE crew manages to find the predicted amounts of waste, fraud, and abuse in these programs like Medicaid? It actually is likely to extend and expand the life of that program, isn't it?
Absolutely, right? So President Trump said that the House committee that oversees Medicaid has to find $880 billion to cut. And people are, freaking out thinking that Medicaid is going to be cut. But leaders, can make these cuts if they just follow the existing recommendations that have been made over the years. One of the biggest examples of waste in the program is double payments. The Wall Street Journal had a report recently that between 2019 and 2021, states paid $4.3 billion in double payments to Medicaid insurers. This is from people who moved from one state to another and did not disenroll from one state, and they enrolled in a second state, and so they were enrolled twice, and these Medicaid insurers were paid twice. And so, that $4.3 billion, it's just a small sample of 3 years worth of these double payments. This is a problem that the Centers for Medicare and Medicaid Services were aware of. Actually, the Inspector General for HHS found in 2019 and 2020 about $1 billion a year was being wasted on double payments. So, the director for Medicaid audit said this should be low-hanging fruit. The data is there showing this is a problem. Let's fix this. In 2022, CMS rejected a recommendation from the Inspector General to use national data to detect double enrollees. They said that their existing system was adequate. Well, it's clearly not adequate if $1 billion is being wasted on double enrollees every year. So that's a perfect example where you can save money. I mean, $1 billion a year clearly is not anywhere near the $880 billion we're talking about, but there's other examples of fraud. California, there's a new report from Economic Policy Innovation Center and Paragon Health Institute. They did this investigation that California implemented a scheme where it was able to essentially launder federal funds. The state increased taxes on Medicaid insurers, which results in an equal payment from California, and then California then invoices the feds, and the feds match 60% of their Medicaid spending. So that added revenue can go toward paying for care for more people. In this case, it was used on illegal immigrants. So that should not be allowed to happen. It's a sort of loophole that needs to be eliminated. And there's so many more examples of waste, fraud, and abuse that can be cut from Medicaid and Medicare and Social Security and practically any federal agency.
This just really sounds sleazy. The state of California could not have done this accidentally. I mean, just so people, and tell me if I'm wrong in understanding it this way. Let's say California spends $1 billion on Medicaid. And then they say, well, we're short of cash. We normally tax these folks 10%, which would be $100 million. But we're going to raise the tax to 15%. And then we'll get $150 million out of Medicaid in taxes that we can spend on anything we want to spend it on, because that's entirely a state decision. You've laundered that money in, and then you just tell the federal government, by the way, the cost has gone up, so you need to send $1.1 billion or $1.05 billion, which would then make up for the $50 million you just stole out of Medicaid.
Right. Absolutely. So in this case, what happened with California when they raised these taxes, they generated $16.7 billion in revenue.
Whoa.
And so, right. So the federal government matches payments to Medicaid. So they invoice the federal government. Their 60% match is California gets $9.5 billion from the federal government. And they went and used that to expand their program in part to put illegal immigrants on Medicaid. That obviously should not be allowed to happen. If the federal government is going to match states, they've got to abide by the same eligibility standards for who can go on Medicaid. They knew exactly what they were doing.
Okay, so tell me this, Rachel. Usually when somebody's cheating, I say there's got to be a motivation, and most of the things that motivate people on planet Earth are money, sex, and power. So why would Medicaid or the CMMS that's overseeing Medicaid, Medicare, and all that, why would they not be interested in solving the double payments problem? I don't understand that because Even a private, well, the private company does it for a profit motivation to say, we're not paying for Lars in Washington and Lars in Oregon. I'm not on Medicaid, but if I were, the private company would say, we're not paying twice. In fact, when I've been in the hospital emergency room with family members, one of the first questions they ask is, do you have any other insurance? Why is Medicaid or CMMS so uninterested in finding out if they're paying two different entities for the health care that was only delivered to one person?
Right. Well, they absolutely should be. What you find, of course, in federal bureaucracy is that there's little motivation to make changes, right? For whatever reason, they claim that their system that they had in place to detect double enrollees, they claimed it was adequate. $1 billion a year is getting through. So clearly it's not adequate. They do need to make those changes. I don't know why they would push back on making a change to save money. It is absolutely ridiculous. They did, one of the major companies, Centene, is the biggest Medicaid insurer, and so they're the one most reaping the benefits of the double payments. They said that they did repay about $2 billion to states between 2019 and 2021. Who knows how far back, though, they continued to collect the double payments, right? That's just a one-time sort of refund. The fact that this company would be willing to give this money back means that they're well aware they shouldn't have had it in the first place. There does need to be a will.
Well, and let me ask, Rachel, if they're the biggest dog on the block, why is it that having knowingly kept money they knew didn't belong to them didn't automatically make them disqualified from being a Medicaid provider?
Right. Well, they claim if you go into detail, there's really great reporting from the Wall Street Journal. They claim that a state can't, or rather the company, the private company, can't disenroll somebody until the state informs them of it. So, for instance, they quote a supervisor who contacted their employees and said, make sure you keep Medicaid recipients enrolled even after they moved. Do not close out cases, even though you've learned that someone has moved out of state. If they are, it says if the member shows they're eligible and out of state, they can still utilize some of the benefits. So they were still keeping them on, again, they said because the state had not informed them.
Unbelievable. That is Rachel O'Brien. Rachel is the Deputy Policy Director, Editor at OpenTheBooks.com. She's also an investigative journalist. Rachel, it's always a pleasure.